Hi friends, today we'll be seeing how does pediatric practicals has to go about it. So firstly, let us see that what are the important things which we need to know as a pediatric practicals course. First important thing is it's for 100 marks. Like rest of the other important things, for example, OBG surgery or medicine goes for 200 marks, but this is one of the core subject which goes for just 100 marks. And again, the overall things which we are discussing from ENT is that again the overall thing that is the overall your practicals can be divided into case based and non-case based. Again, case based occupies the major important things and decides whether you pass or not. Again, major case and minor case. One major case is for 40 marks, and there will be two minor case that will be again for 40 marks. Then what are the important things which can come as major cases? That's cerebral palsy and GDD and thalassemia. One important thing which I would like you to emphasize is that for the fact that these are chronic cases and these might not get they might have not been admitted during your postings of during the time when you were posted. So major emphasis has to be given for major case itself, right? It's for 40 marks. So I would highly recommend you to get prepared at whatever time so that you are not in a situation where you need to again get struck during those time. Then again, two minor case. One important case which you need to study is that newborn. Or something related to newborn itself. I feel so 90 to 95% of the people, one minor case would be of newborn. That might be a normal examination, and also template itself is quite new, right? So major emphasis has to be given to this part, that is newborn, especially in minor case. Then again, one more main idea of minor case is that how do you do about other system. For example, GI or RS, for example, you might have a case of pneumonia, or you might get a case of acute diarrheal disease, or if you are not getting anything, one case of cerebral palsy, one case of thalassemia can be kept. Okay, for example, I mean to say one cerebral palsy with one newborn and thalassemia is what I mean to say. Okay, that is one important thing which you need to, or the major importance is which they want to test is also that is systemic part. So what is the overall idea which they want to test? One, what is the major core in major, that is how do you know whether you know how to evaluate for chronic diseases, especially related to CNS is what they are testing, and also that is CNS and hematological things which they would like to test. Again, another, what is the major under two minor, what is the one core idea of minor is that whether that you know about newborn. That is one major thing which they discuss. And also one more important thing, what is the aim or RGUHS has to say is whether you know examination of other system. Though it is already dealt in medicine, how is that different from medicine is what they will ask you, especially about GI and RS is what they focus more on. Again, if you get a CNS case, they will keep. Again, this is bound for your bound to what are the cases which are present. So again, it's a topic for discussion. Again, you might if there are cases of congenital heart disease, they can keep. Again, obviously they cannot be called how cerebral palsy cases can be called, because they majority of them would always get it done operated, right? So those are some of the constraints for the cases itself, which is not there in us or with teachers. So make sure you study smartly a day before exam, or what are the things which is actually there. And remaining is for 20 marks, so that is nothing but Viva boss. So again, how it is going is that you might have 4 station or 2 station depending on the college. Again, there are colleges where they keep it for 4 station, there are colleges where they keep it for 2 station. But what university has to say is that they basically will have 4 station. One is for x-rays. Again, you might have x-rays related to your pneumonia or preterm or exam. Even there are some x-rays, especially broadly divide x-rays based on your new preterm and normal children. So majority of the x-rays are focusing majorly on GI and RS, so make sure you know it accordingly. And also before starting, explain the gist of the x-ray, whether it's AP or PA. Again, if you want to talk about the normal anatomical position also, then you start talking about the pathology which is involved. Okay, then next, again coming to nutrition. Again, there are few colleges which they just keep just some dal or something, and they just ask you to name those things and what is the amount of calories or proteins and some things. And there I have also seen some colleges which they keep charts. So again, it's something which you need to ask your seniors and then need to decide. And one more thing, these two, again the core part of this is again they will test whether you know your pediatrics and pathology part of it. Again, the major instruments which they discuss is about the pathology, that is the biopsy needle, LP puncture needle, and also the for this category, all those things. That's the same thing. Okay, instruments almost at the end, no, medicine and allied, and surgery and allied, which you need to study for practicals, if you ask me honestly. So medicine and allied has few instruments in common, surgery and allied has few instruments in common. So study uh, general things in common, so that you know how to manage things which are not in general. And also drugs, obviously it depends on which they will want to ask, especially here they will ask something related to vaccines itself. Okay, um, 1 second. So basically here they would like to ask something related to vaccines also, is something which you need to know. But what is the important thing which I would like to emphasize on cases, that never skip an examination, and especially never skip mentioning about your nutrition and also the growth chart. If you don't plot a growth chart, you will not get full marks. I mean, though nobody will get full marks, but I'm saying talking about growth chart, nutrition and immunization is a core pediatrics topic. Even if you don't arrive to the proper diagnosis, I don't think they care. But if you are missing something related to your growth, head circumference, height, then obviously weight for height for weight, all those things are pivotal, and you should know in and out of it. And you should plot a growth chart irrespective of whether they give or whether they don't give. You need to take it and go, and you need to plot a growth chart. That is what the major thing which they test. And also in and out of about vaccination, in and out about your nutrition. That is all. Though you can have a basic template in mind, and you can try to fit all those things in mind, but make sure you don't fumble up during the presentation. That's what that's what is the major part in pediatrics. I'll be uploading all the important videos related to vitamin in the description box, like how I had uploaded for ENT and of that, so you can check and make notes of all those things also. That's it for pediatrics. I would like to wish you a very best. Thank you.